Are the employers that are providing a stipend in their employment payouts towards health care, how is that going to change their process? So for instance, I'm getting compensation every 2 weeks to use towards health care, but I have to go out and choose it. My company's just giving me the money to go choose it. How are those kind of companies going to change?
Well, that I don't know what size of company you have, but there could be subject to penalty if they're not actually offering health insurance, they're just offering compensation. So that'd be something that the company itself will need to address with themselves around whether or not they're actually meeting the obligation of providing essential health care to the employees.
Want to add to that, anybody?
Sure. You'll also be able to go to the health insurance exchange and purchase health insurance on a guarantee issue basis, and depending upon your income, you'll still be able to qualify for the premium tax credits, which would lower, the
on an individual basis.
On an individual basis. So you'll have some options, and employers will have to decide, is it worth paying the penalty or paying the health insurance, the employer share of the health insurance. For some employers, they may decide that it's worth paying the penalty.
Okay, I see. I'm gonna walk around with the microphone here. Well, I'm just gonna walk up and greet you and have you ask the next question.
Would the income that she's receiving from her company to pay her own, is that taxable to her?
Absolutely, yes. So the income that you receive to pay your own health insurance would be included in your wages. And if you're high income, then you get to pay another 0.9% over that $200,000. Go for it.
Donna has a question.
Tim, I'm just wondering, when you talk about, when we're talking about the 30-day readmission to hospitals, is that right? Somebody could be at another system, come here a week later? And also, how does that work with nursing facilities that are providing?
John's question is about the readmission penalties. As I talked about, if somebody comes to the hospital, we treat them, they go home and they're readmitted within 30 days, we don't get paid for that second visit. That is true, and it doesn't matter where they're readmitted. So if a patient comes here to Mercy Gilbert, we treat them, they go home, they stay sick or something happens and they're readmitted up the road at Banner Gateway, then Banner Gateway is not reimbursed for that readmission. So it doesn't really matter where you go.
On nursing facilities?
Nursing facilities, I actually don't know. I don't think it applies to nursing facilities.
And some of the guidelines on this have not all been put together, because what you're going to see are hospitals that start dickering with each other for payment. So you're going to have a lot of, because if they initially started at Banner and came here, we're going to say to Banner, look, it's ultimately your problem. So I think we're going to have to work that out among our competitors.
Because we might not necessarily know they were hospitalized. But what about rehab facilities?
I think some of that is still sort of working its way through the guidelines.
Okay, other questions? There's a question. Let me make my way over here.
I have a question just about both of my stepchildren are autistic, so they receive a lot of state funding. With the state choosing to go with a federally managed program, do you see this impacting at all the state funding for like the special needs children and the therapies and everything like that, or is that something completely separate?
Two things. States had the opportunity to select what's known as a benchmark plan for essential health benefits. That all individual and small group policies will have to cover part of their new policies January 1st, 2014. The governor selected the state employee benefit plan primarily because it had richer benefits for autism and other behavioral health issues. So there'll be more coverage for commercial insurance coverage for autistic children. But it does not affect the state funding for special needs kids and the state services that are available.
Yeah.
I have a question regarding the requirement for all Americans to be covered in regards to self-employed and unemployed individuals. How will that be monitored or enforced?
So how it's going to be monitored, there's been this whole argument about the enforcement of that. The disclosure of that we're anticipating will be on your individual income tax return. And there are some exceptions to the individual health insurance requirement that is for lower income individuals. So yeah, it's going to be a challenge. And then to collect the penalties, I know there's this whole argument where the IRS says we're not going to be responsible for collecting these penalties, but I would anticipate to see that on the individual income tax returns. So then the question becomes, well, what if they don't file a tax return? That's a whole nother thing. You know, we may see a lot more people, a lot more non-filers, and people not compliant with federal regulation because it's just becoming more and more punitive. It's a problem.
Yes.
You said something about you recommend LLC change to an S corp.
Well, if you are a business owner and you are a limited liability company, then 100% of that net income is subject to self-employment tax, which could then be subject to the additional 0.9% Medicare surtax. If you're an S corporation, you can take your income in one of two ways. Part of it is as wages because you become an employee of the S corporation, and then you may take dividend distributions. And the interesting thing is the dividend distributions from an S corporation in which you are actively involved in a trade or business are not subject to either the 3.8% under the passive or the 0.9 under the active. So that's definitely a big, big opportunity for LLCs to change to an S corp structure for tax purposes.